Now, new developments, the Glenn Medical Center has an official closing date for its hospital and emergency room services. Action News Now reporter Margot Rowe shows us how the community is handling the news.
The Glenn County Medical Center emergency room and hospital services will cease to exist on October 21st. And while staff and admin are preparing for the transition to find new jobs, they're also hoping for a miracle.
The community and the people who work here are absolutely devastated. Without this service, there will be a lot of loss of lives. There will be loss of stability for those who have worked here their entire lives.
Assistant ER Manager Bradley Ford says these services are shutting down due to the Center for Medicare and Medicaid Services, or CMS, denying the center's renewal of its critical care license after 25 years.
So with their new zoning or their new route, they found that we were too close to Colusa Medical Center, and so they rejected our application to renew our critical care access accreditation, which is how we receive a majority of our funding at this hospital.
Clinic services and medical records will still be available after the October deadline for a short time. But Director of Nursing Brittany Mundy says that they're working to help the 250 employees who will be affected.
So we're trying as best we can to get as many of our staff members placed within our company, and then those that we can't, we're still trying to help them find jobs, whether it's locally just in Glenn County, if they're, people who live here in Willows, but we're just working with all of our staff to try to get as many jobs as possible.
Ford says losing the emergency room can be detrimental to the community, especially for patients who are suffering from a stroke or a heart attack.
The impact is going to be those patients that require stabilization prior to transport or prior to being transferred. So it's estimated that the morbidity rates of STEMI patients or heart attack patients will go up 10%, and those suffering from a stroke will go up 15%.
Ford says the finances are not there on a county level to save the hospital, but they're still open for a miracle.
There's always a Hail Mary or a miracle that can happen. That would look like someone coming in to assess this establishment and see, if it was financially viable for them to continue services here. Of course, our parent company has exhausted countless resources.
And people I spoke with in the county say the loss of services is beyond upsetting.
You don't want to be driving all the way to Colusa when someone has a problem. And I just think, like I said, every town should have a hospital or emergency or a care center to take care of these things that happen. This family is a farming family, and emergencies happen. They don't have time to drive them so far, but I can't imagine closing hospitals.
Ford says the emergency room could close sooner than October 21st if there isn't enough staff remaining to keep it open safely. But Mundy says it appears all staff are looking to stay till the end of the line. Reporting in Willows, I'm Margot Rowe for Action News Now.
Glenn Medical Center is hosting a job fair September 16th for its employees. They hope to hear from all employers looking to hire.